Fatty liver is a condition characterized by the accumulation of fat in the liver cells. In a healthy liver, a small amount of fat is normal, but when the fat content exceeds 5 to 10% of the liver's weight, it is considered fatty liver disease. While some symptoms of fatty liver are well known, there exists a realm of hidden symptoms that often go unnoticed, making early detection and intervention challenging. Today, we'll be ranking the top 10 worst symptoms of fatty liver disease. Kicking off our list is something we all know too well: fatigue or feeling tired. Fatigue is a common symptom, but in fatty liver disease, it can be subtle. The compromised liver struggles to process toxins efficiently, leading to a buildup of toxins that contribute to persistent fatigue. But when it comes to fatty liver, it's not your typical "I need a nap" tiredness. It's more like your body's energy switch is stuck in the off position. Imagine trying to run a marathon with a backpack full of bricks. That's the fatigue that comes with fatty liver, draining your energy and leaving you weak. One way you can identify this at home is to distinguish between normal tiredness and excessive, unrelenting fatigue. Seeking medical advice when fatigue becomes chronic is essential for uncovering potential underlying liver issues. Next up, we're talking about a symptom that's often overlooked: brain fog. There is a protective barrier between your blood and your brain called the blood-brain barrier. Normally, this barrier keeps harmful chemicals out of your brain, allowing only the essential nutrients to pass through. Fatty liver can interfere with this protective barrier. Harmful substances that should have been filtered out by the liver may find their way into the brain. It's like a fog settling in your brain because these unwanted substances create confusion and disrupt normal brain function. The brain fog caused by fatty liver can affect your ability to think clearly, remember things, and concentrate. It's similar to trying to see through a foggy window. Things are unclear, and your brain isn't as sharp as it should be. Be vigilant for unexplained shifts in mood, cognitive function, or personality. It's essential to communicate these changes to a healthcare provider for a comprehensive assessment. Now, skin abnormalities can be another hidden symptom. The skin often serves as a visible indicator of internal health, and in the case of fatty liver, skin issues can be an unexpected symptom. Fatty liver can disrupt hormonal balance, leading to conditions such as persistent acne and other dermatological problems. Hormonal changes triggered by fatty liver can stimulate the sebaceous, oil glands in your skin, leading to the development of acne. It can also manifest as dark patches on the skin, commonly known as acanthosis nigricans. This condition is linked to insulin resistance, a common accomplice in the progression of fatty liver disease. One way to identify this at home is to observe for dark, velvety patches on the skin, particularly in body folds such as the neck, armpits, or groin. Consulting a dermatologist for a thorough examination can provide valuable insights. Next symptom is gastrointestinal distress. The liver and the gut are interconnected, and changes in the liver can influence the composition of the gut balance. Fatty liver disease has been associated with alterations in the gut microbiome, causing imbalance in gut bacteria, which may contribute to digestive problems, leading to inflammatory conditions such as leaky gut syndrome. In addition, conditions such as bloating, excess gas, and constipation may arise. One way to identify this at home is to pay attention to changes in digestive patterns and consult a healthcare professional if gastrointestinal symptoms persist or worsen. Next symptom is low platelet count, the silent sentinel of liver health. Platelets, crucial for blood clotting, can be affected by impaired liver function in fatty liver disease. A declining platelet count can be an early indicator of liver damage, emphasizing the importance of monitoring this often overlooked blood parameter. Here are the symptoms and signs associated with low platelet count. Easy bruising. One of the most common signs of low platelets is easy bruising. Individuals with thrombocytopenia may notice that they bruise more easily than usual, and the bruises may be larger or more frequent. Petechiae. These are tiny red or purple spots on the skin, often resembling a rash. Petechiae result from small blood vessels, capillaries, leaking blood, and they are a characteristic sign of low platelet count. Nosebleeds. Low platelets can lead to spontaneous bleeding, and nosebleeds may occur without a clear cause. The blood vessels in the nose are delicate, and a reduced platelet count can make them more prone to bleeding. Gum bleeding. Individuals with low platelets may experience bleeding from the gums, especially after brushing their teeth or eating. This can manifest as increased bleeding while flossing as well. Heavy menstrual periods. Women with low platelet count may experience heavier than usual menstrual bleeding. Excessive bleeding during menstruation can be a sign that the blood is not clotting properly. Routine blood tests can reveal changes in platelet counts. Regular health checkups are crucial for early detection and intervention. Next hidden sign in fatty liver is swollen abdomen. Abdominal swelling, medically termed ascites, can be a hidden indicator of advanced fatty liver disease. As the liver struggles to process fats, fluid may accumulate in the abdominal cavity, causing a noticeable swelling or bloating. One way to identify this at home is to regularly check for changes in abdominal size or discomfort. If sudden bloating occurs without an obvious cause, seeking medical advice is crucial for accurate diagnosis and timely intervention. Next hidden sign in fatty liver is unexplained weight loss. While weight loss is often celebrated, unexplained and rapid reductions can be a sign of an underlying health issue, including fatty liver disease. The liver, a key player in metabolism, regulates the storage and utilization of fats. When the liver is infiltrated by excessive fat, its ability to perform these functions is compromised. Consequently, the body may resort to breaking down muscle tissue for energy, leading to unanticipated weight loss. One way to identify this at home is to pay attention to sudden weight loss without changes in diet or physical activity. Regular monitoring of body weight can help in identifying unexplained variations. Next hidden sign in fatty liver is insulin resistance, a precursor to type 2 diabetes. As the liver struggles to manage fats, insulin sensitivity diminishes, contributing to higher blood sugar levels and an increased risk of developing diabetes. One way to identify this at home is regular monitoring of blood sugar levels and recognizing signs of insulin resistance, such as increased thirst and frequent urination. Glucose monitoring devices such as Dexcom are now available and useful in identifying insulin spikes and patterns. Next hidden sign in fatty liver is elevated blood pressure. Fatty liver is characterized by inflammation in the liver. Inflammation can lead to systemic effects, including endothelial dysfunction. The endothelium is the inner lining of blood vessels, and dysfunction in this layer can contribute to higher blood pressure. Fatty liver may also activate the renin-angiotensin-aldosterone system, RAS, a hormonal system that regulates blood pressure and fluid balance. An overactive RAS can lead to vasoconstriction, narrowing of blood vessels, and an increase in blood pressure. Routine blood pressure monitoring is important for everyone, because simply checking your blood pressure at the doctor's office once every 3 months can lead to delayed diagnoses. A blood pressure cuff can be purchased online at your nearest pharmacy. It's best to keep a log of your readings and bring them to your next doctor's visit. Next hidden sign in fatty liver is impaired sleep patterns. Fatty liver disease can lead to hormonal imbalances, including disruptions in the regulation of sleep hormones such as melatonin. Melatonin plays a crucial role in promoting sleep, and when its production is affected, it can result in difficulties falling asleep or maintaining a regular sleep pattern. One way to identify this at home is by monitoring your sleep schedule and taking note of the times you wake up during the night. Devices such as Oura Rings also provide great insight to sleep patterns and disruptions. Now, if you found this video helpful, please check out this next video on best foods to reverse fatty liver. And don't forget to subscribe to continue improving your health.